Are you living in pain and just don't know where to turn? Well, the folks at Florida Pain Relief Group want to help, and Dr. Gary joins us today to discuss how they can help with back pain. I feel like back pain, you hear that all the time. People suffer with it. So break it down for us, doctor. What is it and how can you help?
Sure. Well, back pain is one of the most common reasons why patients come see a doctor. And the reason for it is very simple. If you think about the fact that your back is what takes most of your pressure, most of your weight, and so a lot of that wear and tear, bending and twisting and all kinds of stuff causes a lot of inflammation in your lower back, and that inflammation leads to pain.
You know, I'm curious. You always hear people say, I threw out my back. What does that mean? A
lot of times that has different meanings. One of the meanings could be just the fact that you get a spasm. So your back actually consists of 31 different bones called vertebrae. Those vertebrae are stacked on top of each other. They should be lined up very nicely. If you twist the wrong way, that alignment gets a little bit thrown off. That's not natural. It causes an inflammatory process, and the patients feel it: spasms, pain, stiffness, those kind of things.
Well, I was saying, then that's when possibly they can give you a call. How can you help back pain? Again, you said it's so common. What do you do?
Well, what we do is the first thing we do is we take a thorough history and a physical examination, because 85 to 90% of our diagnosis comes from actually listening to our patients. Every patient is different. We're going to look at them and find out what happened, examine and touch the patient, figure out what's going on. If we need to, we can send for further studies like an MRI, X-ray, CAT scans, whatever we need. Most of the time it's going to be a simple sprain. It could be something more like a herniated disc, just inflammation in your joints. And depending on where the pain is coming from and the cause of that pain, we're going to target that. So like that we can get rid of the pain with the fewest side effects, the fewest medications. Sometimes it's just simple procedures, little nerve blocks, things like that. That's all that you need, physical therapy, and get you back going again. You
know, I love that about you, Dr. Gary. You always start out by saying we do a background, we sit down, we listen, we talk about your story. I mean, that really sets you apart and sets your practice apart, which is better for the patients.
Well, every patient is unique, and pain could be coming from your muscles, could be coming from your joints, could be coming from your ligaments, from your nerves, from your bones. We have to, we're physicians, we're board certified physicians that have subspecialized in the area of pain management. Most of us have other specialties such as anesthesiology, physical medicine, rehabilitation, neurology, and we had to take further studies to concentrate on the treatment of pain, and there are different causes. We want to make sure that we give you the best results by listening and examining you.
You know, Dr. Gary, so many times I see on commercials and things, people talking about like the heating patches or different ways to alleviate things over the counter. When do you know it's time to give you a call?
Well, it's time to give us a call when it affects your life. So if you're having to use too much of the heating pad, for example, I've had patients come in with first-degree burns.
Really?
Because they use that heating pad so much, they sleep on the heating pad, you can get a serious burn from that. And sometimes it can scar your skin. So when you feel, you kind of know if it doesn't feel right, if it's a little too much, come in and see us. Because the earlier that you come and see us, the earlier that we'll be able to take care of you and hopefully avoid, certainly the last thing we want to be able to avoid is an operation. And 95+% of our patients, we can avoid an operation. But the earlier that we see you to make sure that we put you on the right path, physical therapy, whatever you might need, the better for you.
So again, just to kind of summarize, if it's really affecting your life, that's when you know it's time to give you a call to prevent the surgery.
Absolutely, the sooner the better.
Okay, well, thank you so much again. Great tips, and we appreciate your time. And as always, for more information on how Florida Pain Relief Group can help you with your back pain, you can call 844-KICK-PAIN or just log on to floridapainreliefgroup.com.